Hello, my name's Haley. I'm a student nurse, and today I'm going to be explaining to you how to assess the peripheral vascular system of the upper and lower extremities. To begin with, before you enter the patient's room, you're going to want to perform hand hygiene and knock on the door before you enter. And then once you enter, you're going to ask the patient their name and date of birth and verify it with what you have. So now we'll begin telling you how to assess. Starting with the upper extremities, you're going to want to assess the skin and nail characteristics all the way from the hand to the shoulder for the upper. So you're going to start out with the nails. You're going to assess for any clubbing or any abnormal looking nails that might indicate that that the patient has decreased blood flow. And then you're going to want to check the capillary refill by pressing down on the nail bed and making sure that the color returns within 3 seconds, preferably 2 seconds. So after you do that, you're going to assess the skin characteristics all the way from the hand to the shoulder. So we're going to start with the hand, make sure there's no scarring, no lesions, scabs, rashes, bruising, anything like that. And then also check that there's no pallor, erythema, or cyanosis. You're going to start with the hands, then you're going to move to the arms, check it all the way around, then move to the shoulder all the way around on both sides, and make sure everything's even on both sides. And then, after you check the skin and nail characteristics, you're going to want to test the range of motion and the muscle strength. So you're going to do that by having the patient move their arms in different directions on both sides, with and without resistance, to check their muscle strength. Then their wrist, like this, and then see if they can move it side to side. And then check their shoulders, see if they can do this motion on both sides. And then to check their muscle strength, you're going to have them hold their arms like this, and then you're going to tell them not let you pull against it, like that. So that's checking the muscle strength. And then you're going to palpate the epitrochlear nodes. So to do this, you're going to tell them to shake your hand, and then the other hand that you're not shaking with, you're going to go underneath the elbow and around, and you're going to palpate between the biceps and triceps muscle to find the epitrochlear nodes. And if they are not there, then that is normal, because if they were there, then that would mean that they were enlarged, and it might indicate infection. So after you find the epitrochlear nodes, you're going to assess the radial and brachial pulses. So to assess the radial pulse, you're just going to feel right here on the wrist. Make sure it's palpable and note its strength, so +2. You're going to do that on the other side as well. Note its strength, +2. Make sure the strength is even on both sides. Then you're going to do the brachial. Make sure it's even and palpable on both sides, +2 on both sides. And then that was the last thing for the upper extremities, so now we can move to the lower extremities. So for the lower extremities, you're going to want to start by assessing the skin characteristics once again. So you're going to ask them to sit down if they're not already sitting down, maybe even lay down if you prefer, and either take off their pants or just pull up their pant legs as far as they can get them up. And first, assess the skin once again, checking for scarring, scabbing, rashes, lesions, anything like that. And then you're also, for the legs, you're going to want to check for varicose veins, any edema, pallor, erythema, or cyanosis once again. And then you're going to want to look at the symmetry of the legs, making sure both legs are symmetric to make sure that they don't have a DVT. And then once you check for symmetry, you can move on to finding the pulses. So first you're going to want to find the popliteal pulse. So to do that, the best way to find it is to have your patient lie prone or lie on their stomach and have them bend up their leg like this and press firmly behind the knee, and it should be palpable. And you do that on both sides. Should be the same on both sides, so +2 on both sides is normal. And then that's the popliteal. And then you would find the posterior tibial, which is located on the inside of the ankle right here. You're going to want to palpate that on both sides. And then you can move on to the dorsalis pedis, which is underneath their foot. So to do this, you're going to want them to hyperextend their foot up, and you're going to want to put your fingers a couple inches below their toes on both sides, but with their foot hyperextended. I just have it like this so you can see. So a couple inches below their toes, and that's where it should be located. They might not always be palpable, and that's usually pretty normal, but some people, they are palpable. So then, once you find all your pulses, you will move on to range of motion and muscle strength. So you would just have them move their legs in different positions like you did their arms. Sitting down, this would be easier. Just have them put their foot out, both sides, make sure it's even. Have them do some exercises with their foot, up and down, side to side, around, up and down, side to side. And then you want to test their muscle strength of their hips and their range of motion of their hips. So to do this, you can have them move their leg outwards, because that tests their hip. Move their leg outwards, forward and backward. You might want to have them stand up for this one. And then once you complete the range of motion and the muscle strength, that is it. So now you have hopefully learned how to give an assessment of the peripheral vascular system. Thank you.